Hi everyone, this is Dr. Mona Tureen, and I am a palliative non-hospice doc, and I thought I would take this opportunity to connect with all of
I
you
wanted to first
directly. Address some of the questions that you guys raised, and I noted that one specific common theme actually came up several times in some of my videos and comments. And one of this is around the fact that hospices tend to discontinue home medications and that the patient ends up declining. The truth is that hospices can actually substitute medication. So often, as an example, if a patient is on Ventolin inhaler, they can substitute for albuterol. So they do have certain treatment options to substitute those medications. I think this stems from the fact that hospices are paid a certain amount per day. But more importantly, this is all about the patient and what is their comfort level. And so you will find hospices getting approval for medications which would otherwise be expensive. Not a reason for them to actually not cover the medication. Another reason may be, and again, remember, I haven't seen the patients that you may be referring to, but if a patient is at the end of their life or they have a prognosis of maybe hours to days, some of the medications may no longer be beneficial to them. And as a result, some of those medications may be discontinued. In hospice care, they do continue medications for symptom management. I'll just throw out an example. If someone has congestive heart failure, such as medications such as furosemide or Lasix or aldactone and spironolactone. All these medications tend to be continued because our goal is not to stop medications that could throw them into what we call a symptom crisis. Additionally, if a patient is on what we call parenteral nutrition, also known as TPN, this is something that hospices can get approval for. So it's not that hospices stop medications, it's not that hospices discontinue antibiotics or nutrition, or even if there are a few doses of palliative radiation that's needed. What it does tell us is that these things require approval by the hospice. So I'm really sorry for the experience that you guys had, and I'm always grateful for the information that you've actually shared. But I want you to make sure that I brought this to your attention because being on the other side of things, it's really tough. And I think it's important for at least from my side to share that information with you. So I hope this actually helps to clarify some of the questions that were raised. My goal is always to make sure that palliative care is actually simplified.